Welcome to the third webinar on homelessness sponsored by the League of Women Voters, San Luis Obispo County. My name is Cindy Marie Absey, and I have the privilege of serving as co-president of the League with Ann Havlick, who will be conducting the closing of the webinar today. So today's webinar focuses on individuals who are living in San Luis Obispo County unsheltered, and the unique challenges that living unsheltered poses for them and the community, and interventions that have made a difference. Through this series of webinars, we are first educating ourselves on this humanitarian crisis in our own backyard. We are also laying the groundwork for our league to identify the actions and advocacy that we can take to complement the programs and services currently provided by local nonprofits and governmental agencies working with individuals experiencing homelessness. Now it's my pleasure to introduce our three panelists and moderator. Commander Stuart McDonald. Commander McDonald has served the community with the Sheriff's Office for over 26 years, and he is currently assigned as manager of the Sheriff's Coast Patrol Division. Christina Trezor-Horn. Christina serves as a homeless health social worker for Dignity Health for South County and Santa Maria. She has a master's degree in social work and has worked in human services for 25 years. Among the services she provides are outreach, linkage to resources, and short-term case management. Tim Wog has lived in San Luis since 1992, and he has raised two sons to adulthood with his wife, Sue, who works as an employment attorney. They both have advocated for the homeless for over 20 years. I should mention that we're having some technical difficulties getting Tim's audio to work. So we will continue to work on that. And hopefully by the time we start the panel, we'll be good to go. Our moderator today is Marlis McPherson. And this is her third webinar that she's moderating for us. And we are so thankful for her. She has been a member of the League of Women Voters since 2007 and previously served on the League's board as membership chair. She has been a member of the Morro Bay City Council for 4 years, currently is off the council, and is the city's representative on the Homeless Services Oversight Council, which makes recommendations for services and funding to the San Luis Obispo County Board of Supervisors. She is also the city's representative to the Estero Bay Alliance for Care, a consortium of service providers for the homeless and low-income residents on the North Coast. So thank you to our three panelists for sharing their perspectives, and to our moderator today. Now I'm going to go ahead and pass the torch to Marlis, who will take over, and she will moderate our three wonderful panelists today. Thank you so much.
Thank you, Cindy Marie, and welcome everyone. As Cindy said, our purpose today is really to explore the issue of the challenges that the unsheltered face, and what we're doing as a community to deal with that issue. We're going to conduct the session the way we've done the last two, which is that I will pose several discussion questions to the panelists, and they will have an opportunity to respond. And we will leave time at the end for questions. So if you are watching this webinar now and you have questions, you can ask them at any time. Use the Q&A button to enter your question, and we will collect the questions and ask them at the end of our formal discussion here. It is scheduled to end at 1, but I believe the panelists would stay for a few minutes if we have a lot of questions and a lot of interest. So I'm going to begin by just asking each of you if you would describe your role and interest in the issue of individuals experiencing homelessness and living without shelter. And why don't we start with you, Christina?
Okay, thank you. So I just came into this role about 6 months ago. It's a grant that Dignity Health got to address homelessness in both. I work both Marion Hospital and Aurora Grande Hospital, so I'm working both counties, working with individuals experiencing homelessness. And so what my role provides is I follow homeless patients outside of the hospital and try to connect them with services to help them mitigate the barriers that are keeping them homeless. So with a focus on health because we are a hospital. So trying to just connect them to primary care doctors and medication, and making sure that they are staying as healthy as they can while living unsheltered. So that's my role. I've worked human services, like I said, for 25 plus years. I actually worked at Maxine Lewis, which was the old shelter in San Luis, way back in the day. So I've definitely seen that resource through Capslo expand, which has been great. And then just personally, my husband and I have always had I would say a passion for people experiencing homelessness. And so we've always been one to, make sure if we see somebody, they have food, they have clothes, things like that. And that's just a personal thing that we do.
Okay. And how do you connect with people? I mean, how do you find out who needs your services?
Primarily through the ER at the hospital, or if they're inpatient and they're a complex case, then I get involved. I also work with the local agencies. So for San Luis Obispo County, I work with Five Cities Homeless Coalition, specifically because I'm in the Five Cities area. So we connect as well. And then hoping to establish with law enforcement in the Five Cities areas. I know they have a CAT team that goes out and also works with individuals that are unsheltered. And then in Santa Maria, I work with United Way, which is their version of Five Cities Homeless Coalition. And then I also work with Santa Maria PD, the police department. They will call me when they come across an individual who maybe needs support. And then I respond out and try to support them in doing a different way, of helping the individual, instead of them having to cite them or, move them along. They call me to see if there's any resources I can connect them to.
Would you go actually visit personally?
Yes, I go out into the community. So I go into the encampments. I meet individuals out there on the streets. If the the police department calls me, I go out there. So yeah, I work a lot in the riverbed in Santa Maria, which actually has San Luis County residents and Santa Barbara County residents, because it's that line for us. And then I go out to the encampments in the Five Cities area as well, trying to just connect with individuals outside of the hospital, because prevention is also something we're looking at as well, as far as health. So if I can connect them outside of the hospital to services, instead of them coming into the ER, which the ER seems to be the place that individuals experiencing homelessness know they can go and get food, and they can try to get some support. So it seems to be that one place that they all know that they can come.
Okay, thank you. Stuart, why don't you tell us about law enforcement's role?
Thank you very much, and thank you for the opportunity to be with you here today and to help the community understand this very complex issue. Obviously, this is just one of a series of presentations on the homeless issue, and so I really appreciate the opportunity to be here and to answer questions and help the community understand this complex circumstance. So in terms of our role in helping people living unsheltered, it starts with the sheriff's office mission statement of protecting all life and property and providing service, security, and safety to the community. That means the whole community, regardless of the circumstances that any community member finds themselves in. So our on-duty patrol resources are always available to respond to any concern that might be called in regarding the homeless or the unsheltered population. But then, as Christine alluded to, most law enforcement agencies, including the sheriff's office, also have some dedicated personnel that are focused primarily on these issues and teaming up with outside services, mental health services, drug and alcohol counseling, homeless shelter providers, Department of Social Services, that sort of thing. And our community action teams, which some of our law enforcement community action teams are a partnership between a sworn peace officer working in direct partners with behavioral health specialists from the Department of Behavioral Health Services. And they are going into the specific encampments, the areas where unsheltered people are living, and developing relationships, trying to bring whatever services that individual might be in need of, and making those connections so that we can serve the ultimate purpose of moving as many people as possible from unsheltered circumstance to permanent housing.
Okay, great. And the CAT teams, how do you interact with other law enforcement agencies in the county? Do you coordinate, for example, with the Morro Bay Police and San Luis Obispo Police?
Yeah, so most jurisdictions, well, I'll rephrase that. Many of our jurisdictions have personnel that are specifically dedicated to homeless issues, and there's quite a bit of collaboration and communication among those team members. And as we go through this webinar, I'll share a lot of information that's very generic about law enforcement and homelessness. So we're all facing the same challenges in terms of how law enforcement can best, be a service provider that can move the goalpost toward more sheltered people rather than less sheltered people. But we work closely with our agency partners across the jurisdictions.
Okay, great, thank you. Do we have Tim?
So, I do not know what happened. I had everybody audio and video, and literally at the start time, it went silent. So,
Well, we
okay.
got you now. So I'm just asking each panelist to describe their role in handling this issue and responding to this issue. So why don't you, I know you're an advocate, but please explain what you do.
Okay. I've been a homeless advocate for homeless shelter overflow that many of you are familiar with, the program through the 12 houses of worship in and around the city.
You're breaking up, Tim.
And can you hear me?
Yes, now we can hear you.
Okay. All right. Because in any case, if you can hear me, we each took 1 month of the year and housed 30 to 40 homeless people that were brought over from the SLO shelter. Then in 2018 with 40 Prado, that ended, but that got me started. I managed the overflow at United Church of Christ during the month of July, during all those years. And ever since then, I've been working with about 15 different homeless advocate nonprofits to do homeless outreach, primarily with the chronically homeless.
Okay, so I take it you're feeling a need when the shelters are full and you need to find other places to house people. Is that basically what you're focusing on?
Correct. There's really, when you work extensively with chronically homeless people with the homeless community in general on a volunteer basis, you realize there's, let's just call it temporarily homeless through bad luck. Those are good candidates for the shelters. But as we know, the chronically homeless, those who have been homeless 5, 10, 15, 20 years, that's the group that's not likely to get back into housing or it's helping, frankly, because they need the most help.
So would you go out and actually visit the encampments and, or how do you identify people or find the folks that need that help?
Yeah, that is correct. I pretty much every day that I am in San Luis Obispo, where I live, I travel on occasion. Every day that I'm not out of town. I am going to a homeless camps around the city of San Luis Obispo for go out to the homeless camps 2 or 3 hours a day.
Yeah, you are breaking up a little bit, but we're trying to get as much as we can. I'm gonna turn now, at the last webinar, I shared some data from the last point in time account survey, which is of course mandated by HUD, Department of Housing and Development and Urban Development. And they of course do a survey every 2 years to try to identify how many homeless and where they are. And as we know from that data, the most recent data was 2019, 79% of the homeless people are in fact unsheltered or were unsheltered when they did the survey. So that's a significant, it means that the majority of those people that are experiencing homeless are in fact unsheltered and living in conditions that really are not fit for human habitation. I'd like to ask Stuart, what is the legal basis for what does the law say about people living unsheltered in public places? Is it against the law to sleep in your car or an RV parked on a street or in a public parking lot or in a tent or on public property or in a homeless encampment?
In terms of law enforcement, what is enforced are either local ordinances or state statutes. There's, well, first of all, living unsheltered or being homeless is not a crime. There's no statutes that address that status that a person is living in. But having said that, there are a number of communities that have passed various ordinances or statutes that may say something along the lines of no camping in a vehicle on a public street in a certain community. There is a state statute that deals with illegal lodging, which basically says that it's unlawful to camp without the permission of the property owner on lands. When we're talking about private property, there's certainly trespassing laws that are something that law enforcement deals with, and then there's then there's sort of a different circumstance with publicly owned lands that are covered by those kinds of ordinances. And so what the current state of things are is that regardless of why those ordinances came to pass, whether it's a beach community that just has over the years seen an influx of people that want to come to the beach and camp on a public street rather than go to an approved campground, or if it's somebody who is unsheltered and moves their RV from place to place. Where we're at in terms of enforcement of those kinds of ordinances is that someone who is living unsheltered or living in their vehicle, if the circumstance is that there are no shelter accommodations available for that person, then enforcement of the ordinance is not possible. And that's under case law in the Martin versus City of Boise decision, which is binding in the Ninth Circuit, which is most of the Western states. And so all of those ordinances can in fact be enforced still, but there has to be available shelter space to meet the needs of people living unsheltered. And without availability of shelter, then we would not be able to, i.e., write a citation or make an arrest. And quite frankly, those enforcement actions are a last case, scenario. That's not what we're not interested in doing that. We're interested in maintaining the order that the statutes were passed for the intent of maintaining certain order within the community. But enforcement, we're looking for voluntary compliance with those ordinances, and enforcement through a citation or an arrest is sort of a last case circumstance. And as I've said, with the Boise decision, if there's not available shelter for somebody, then we really wouldn't be able to take that enforcement action anyway.
Okay. Thank you. Christina or Tim, would you like to comment on this issue at all?
So this is Christina. I'll just support Commander McDonald. The law enforcement that I have come in contact with, their motivation is not to cite or arrest anybody. They're looking also for a solution to help the individuals, as well as, still trying to enforce, the ordinances that people have voted for, put into effect. So I have had a great experience working with law enforcement to try to find an alternative, to help the individuals so that they aren't, camped out on the sidewalk, or maybe breaking any ordinances. So I just support with Commander McDonald's statement that, they truly are not trying to arrest these individuals, but more so trying to find a solution as well. But with the lack of shelters, I'm sure they feel it too. You're very limited in what you can do to try to assist somebody. So.
Yeah, and let's take a case of, let's say somebody here in Morro Bay. We don't have a shelter here. So if we encounter, or law enforcement encounters somebody and they don't have transportation to get to 40 Prado, what happens then?
Experience that a lot. And if you don't have an ID too, what I don't think a lot of people realize is most of these services that these individuals need require some form of ID. And most of these individuals do not have the ID because it's been stolen or lost in the different moves and transitions. So there's definitely a lot of barriers. And again, I'm sure Tim has seen that, and Commander McDonald has seen that as well, as even if they would drive them. I've seen law enforcement do that. We'll drive you to the shelter, but if you don't have an ID, you can't even get in. So your hands are tied as a service provider in trying to help them.
And Tim, do we have you back? I guess we don't. Okay. Well, how would you describe what it's like to live in a shelter or live in your car?
Okay. So, I mean, it's a really difficult situation, whether you're in the shelter or not. If you're in the shelter, you're sharing a space with, anywhere from 50 to 100 other individuals who have their own issues that they're trying to deal with. And so there's not a lot of privacy. There's not a lot of, ability to maybe take a time out or take some space if you need it, because, to keep everyone safe, of course, the shelters have to have some level of rules, to make sure that everybody's rights are respected and they're in safety. So it can be really hard, especially like Tim was mentioning, our chronic homeless. If you've been free, basically, have the ability to come and go as you please and kind of be by yourself, that can be a really restricting, place to be. The encampments, the ones I've seen, yeah, you lack basic necessities. So you don't have a toilet or a shower or things like that, but they've gotten very creative. And a lot of the encampments look like you and I going camping somewhere. They've established some type of heating, they've established some way to cook, but they don't have the ability to keep, food safe. So you're limited in what they're eating. So I think that that's kind of a lot of what I've seen when I've gone out into the encampments. You don't have the ability to wash your clothes. So while the shelter provides that for you, it also provides other issues. So you kind of, I think, as an individual experiencing homelessness, weigh what's more of a priority for you. Is it being able to kind of not be around all those people because there's mental health issues, there's substance use issues, and not have access to showers and bathrooms? Or do you go into a shelter with rules and have access to showers and bathrooms, but then you're facing other
Okay, we're talking about what it's like, what the experience is like living unsheltered, either in your car or in an encampment.
This is crazy. Everybody can see from the conditions of the camps as you drive by that it looks a lot more like Los Angeles and San Diego than it used to. Obviously, we have tried through the Blue Bag pilot trash pickup pilot program that we successfully executed to pick up trash at homeless people's camps. It was this huge success, and then it was abandoned, even though all parties wanted to pursue that in the future. It never ended up being pursued. We identified the fact that if we can't provide housing for homeless people, we should provide humanitarian services at the camps where they currently are. That starts with trash pickup, toilets, lockable security facilities so their stuff doesn't get stolen, and finally, mobile showers.
Okay, great. And I was asking Stuart just a moment ago about the law enforcement's concern about the health and safety issues. And if you would like to comment on that.
Yeah, so as the other panelists have mentioned, hygiene is probably the number one challenge, and having some way of making sure that those needs are addressed is really a high priority for the community. And then in terms of just living outside unsheltered, food storage, personal property storage, all of those things become an issue. We do have theft problems within those encampments. There's not a lot of formal theft complaints made to us, but within those homeless communities, in those unsheltered communities, they also have some informal rule making and keeping amongst themselves. And so, while we try to maintain that open relationship with them and maintain the trust for any of the issues they might experience, we tend to only get called when someone is maybe acting in a violent way, or maybe is under the influence of drugs or alcohol, and in a condition of not being able to care for themselves or other people. And so a lot of our enforcement, as it were, it does revolve around drug and alcohol intoxication, and then circumstances where there's been violence. I will say that the violence is not exceedingly prevalent. It happens occasionally. More frequently, we see drug and alcohol intoxication, and we do respond to that, and we take enforcement action because those are circumstances where people are unable to care for their own safety or for those around them, and so we do take them into a very temporary custody circumstance so that they can become sober and be more capable of caring for themselves.
And how has the COVID pandemic impacted your ability to do your job? And I'll start with Christina.
So the pandemic has definitely created barriers. I think more so to access to resources than anything else because of the pandemic. Now the shelters are also under a different set of rules, and they've had to close down on, a couple times during this pandemic because of positive cases within the shelter to keep everyone safe, which is then, limited any type of access to even try to help somebody get sheltered because there's no bed space or no bed availability. Same with the other resources out there, like the mental health response team, Team Hot, and with Fi-Cities Homeless Coalition, I know they had to scale back what they could do as far as like driving somebody to the DMV because of COVID precautions. So it's definitely, I think, impacted for me. As far as actual statistics is homeless individuals testing positive for COVID, I think we're going to find when they actually do, and I don't know if there's stats out there now, but I can tell you in both the hospitals, the percentage of homeless individuals coming in testing positive for COVID is very, very low. So as far as like a safety for myself or a concern for myself, that hasn't been a barrier. I'm more, what would I say, more wary of scabies and lice and other, communicable diseases or situations than COVID per se in the homeless community. And I don't know why that is, whether it's because they're outside, whether I don't know, but it's been very low. And I think in both of our hospitals, I would say the majority of homeless that tested positive for COVID were living in multi-person situations, like within housing. A lot of our agriculture workers are some that have tested positive, or maybe living in a congregate setting, like a boarding care or housing like that. So I think the biggest barrier has been just the impact COVID has had on our other service providers to provide resources.
Okay. And Tim, what about you? How has COVID impacted what you're doing?
Well, the pandemic has made everything worse for homeless people, as you might guess. There are less places to charge your phones, less places to go to the bathroom. So overall, the conditions for the homeless got dramatically worse during the pandemic. And of course, similarly so for the volunteers. And I largely work with all volunteer groups doing homeless outreach. And first off, we lost half of our volunteers because they were elderly and did not want to get the coronavirus. And then on top of it, we had a steady stream of 200 or 300 pounds a week of food we got from the food bank. And through a county grant, we now get 2,000 to 3,000 pounds of food a week, that's a lot. That's like 2 pickup loads stacked to the gunnels with food, and we have less volunteers in order to distribute that food. And in addition, again, somewhat inexplicably, particularly during the entire thing, the CDC issued guidelines on their website.
Go ahead. I'm going to have to switch to Stuart. Tell us how it's impacted your ability to do your job, how COVID has impacted you.
Hopefully we're coming out the other end of the worst of the COVID circumstance, but COVID has very much impacted congregate living situations. I.e. Congregate shelters, but even like the county jail. Early in the pandemic and through to this day, there are a lot of lesser level crime that we would used to take individuals into custody and house them for whatever period of time in the jail. And that's just not possible in this circumstance. So a lot of the lower level crimes result in a citation release immediately in the field. Over the course of the year, this probably isn't a significant contribution to the unsheltered population, but knowing that those that are chronically incarcerated are also the population that have sheltering issues. Those that may have been in a jail setting, during the cold winter months, very well may have ended up contributing to the increased size of the unsheltered encampments that we see in the community. And ultimately, we don't want to see these individuals in the jail, and we don't want to see them in the homeless camps. We want to see them in safe, secure, permanent shelter, and being able to gain the tools to be productive in whatever way they choose within our communities.
Yeah, and let's explore that a little bit. Why now, aside from obviously the economic reasons why someone is not living in a shelter, what are some of the reasons why the unsheltered remain unsheltered? And I'm guessing what I'm getting at, is it because the shelters are full, or because they don't have transportation to get there, or because they don't like the rules? Or are there other reasons why they may choose to stay unsheltered? And Tim, if we can get you, we'd love to get your perspective on that.
My apologies for all the technical difficulties. Anyways, so quickly, what was the prompt again?
The prompt is, why would people choose to remain unsheltered? Is it because the shelters are full, or they don't have a way to get to the shelter, or they don't like the rules, or are there other reasons why they actually choose to actually remain unsheltered?
Well, this is a great issue. It actually defies all common human logic that a person would desire to remain unsheltered, particularly in the type of homeless camps we have here in San Luis Obispo. No one wants to live in filth and squalor and shame and hiding from law enforcement, afraid their stuff will be stolen every time they leave their camp. So it turns out I've spent a lot of time with this issue with the homeless people talking about this, and they'll often say, oh, I choose, we've heard it time and time again, oh, they choose this lifestyle. When no one chooses to be miserable, live in squalor until they die 25 years prematurely, right? That just defies human logic. The reality is they don't see a way out. They have gone so far down into the abyss through drug addiction, alcoholism, mental health issues, disability, depression. So they do not see a way out. So they actually say, oh, I choose to live this way because they don't see a way back to the lifestyle where they grew up. I always remind people, homeless people, they didn't grow up homeless. Most of them had a mom or a dad or both in a house, and that's what they're used to. So they really do want to be sheltered. They just don't see a way to get there for themselves. So they'll often, to save face and not sound like a complete human failure, they'll say that, oh, I choose to live this way, when in reality, it defies logic that anyone would want to live that way.
Christina, if I could turn to you next. Do you encounter people who actually don't want to go to a shelter, or say they would, the rules are too strict?
So yes, I do. And again, I think a lot of it is not that they don't want to be sheltered. It's just the things that come with going to a shelter. And some of it is rules. But again, a lot of it is sharing a space with, multiple people who also have issues is uncomfortable. It's not, they would rather, stay out in their tent where it's just them and maybe one or two other people, depending on where they're camping or where their, encampment is, then go and deal with the shelters. The other thing too is shelters are limited. So, I believe it's 90 days that you can stay each year at the shelter. So for somebody who has, longstanding mental illness or longstanding addiction issues, 90 days is not a lot of time to address those issues and get a job and find income and find a house, especially in San Luis Obispo County where housing prices are high. So I think that those are also the barriers that they're facing, where they say, okay, I'm going to go. And then here's like 10 more barriers in front of them. And if you don't have the coping mechanisms to be able to make it through each of those barriers, you're going to go back out where it's easier. And it's easier to have your tent and not, do what you've been doing, whether they chose that or not. It's a known to them, than go into this unknown. So I think that's what I've encountered. But oftentimes I'll be like, I can get you into the shelter, and they'll be like, no, I don't want that. I'm fine out here. I'm taking care of myself. There's too many people with COVID. That's another thing I hear is, oh, there's COVID there. I don't want to get sick, so just a lot. And there's also, and Tim, I'm sure you can attest to this, even in the shelters, there's stealing and there's things that go on. So they're like, well, my stuff gets stolen. So there's just so many, I think, things that happen in shelters that also happen in the encampments, and which one can they control better? I don't know, but that's what I've come across.
And is it also the case that if they have pets, they can't bring them, or they are required to have case management, a case manager at the shelter, and they may not want to or care to address their own issues? Is that part of it as well?
I think so. I think the pet thing is huge. And I think Tim can attest to that. But the encampments here in the 5 cities and in Santa Maria, one of my backpacks is filled with pet food, cat and dog food, because that's their companion, oftentimes to keep safe with the dogs as well, but also just that companion that's non-judgmental, that's not going to hurt them, that they don't have to be afraid of. And, up until Prada opened, there really wasn't shelters where you could bring your animals. That was a huge thing. And I think that's too, you find that statistic with domestic violence victims too, which is another topic, but that animal is a huge piece for individuals. Like if I became homeless next week, I don't know, would I want to leave my dog and my cats? Like that's a huge, decision to make. Those are our companions. So I think definitely that's a piece of it.
And Stuart, do you have anything to say on this issue?
Yeah, I'll just, first express great appreciation for Tim and Christina's perspective on this particular question, and just point out that it reinforces what we understand. We need to continue to try to make those connections, that trust, that engagement with each individual. And Tim said it best very early on. Show these people that they are cared for, that they're loved, and not stop asking, do you want to go to the shelter? Are you ready for mental health services or drug or alcohol services? Because it might be the 3rd time you ask, it might be the 6th time you ask, it might be the 100th time you ask, but you have to keep asking, because as Tim pointed out, there is a point somewhere in their past that was a more comfortable circumstance for them. And if we can help them incrementally get back to any level of engagement and contribution to community, that's essential. That's essential for the community, and it's just very essential for the individual. And being able to engage them at any level that they're prepared to engage in.
Okay, and Tim, do you concur with that? That it just takes time to continue to really try to get folks to face their issues and seek help?
Yeah, but remember, you got to keep in mind that think of the shelters, 40 Prado, Echo, as a temporary emergency shelter. They work best for individuals and families who have lost their job, lost their housing, just fallen out of the house market, and they need somewhere affordable where they can save their pennies and get back into housing and get back into their job. Again, I call it temporary emergency shelter. These are not designed for people to live for years in the 40 Prado shelter. And we know families with kids have lived, I know families that have lived there for 3, 4, 5 years with their kids. That's not what it's designed for. It's designed for recently homeless people who need a place to go. Again, a domestic violence victim, you know, they need to get out of their housing. They need to get into something else. But for the chronically homeless, the shelter is really not designed for them. And I got to tell you, I actually was so frustrated with this whole situation that I started my own personal project where I was going to interview 30 random chronically homeless people and write a actual paper on why they won't stay at 40 Prado. And they had a range of different reasons. We've heard many of them, but the bottom line is they all have what I consider good reasons for them not to stay there. And for me personally, because I'm so familiar with all the different options in homeless facilities and organizations, I personally would not stay at 40 Prado. That's me. I wouldn't submit to case management. I would rather take my chances on the street until I could get back into housing. That's just me personally. So I understand why so many people won't stay at the shelter, and they have this wide range of reasons. But that's why we have to have a full court press. The shelter was not designed for every homeless, unhoused person. It was designed for a certain profile of person who was well served to be there and could quickly get back on their feet.
Okay, I'd like to next address the critical issue of how the community reacts to this issue. And maybe I'll start with Stuart and ask you, we know that occasionally the law enforcement goes in and cleans out encampments. Can you tell us a little bit about how you go about doing that and what prompts you to do it? Is it community concerns or what?
Well, yeah, it's variable. The primary encampments that we are engaged in assisting move people from are those that exist on private property. And so those are circumstances where there's trespassing occurring, and a private landowner becomes aware that maybe an individual or a group of individuals has taken up residence somewhere on their property, and they reach out to us to enforce their private property rights. And so we'll go through a process where we, certainly engage those people, the unsheltered persons that are trespassing, and provide them with the available resources in the area. But we act fairly rapidly with those encampments because they are on private property, and the crime of trespassing is occurring. And then there's sort of a secondary set of encampments that are on publicly owned properties. Those, well, I'll say, generally speaking, we, law enforcement, and us specifically, the sheriff's office, we don't choose which encampments we're going to move along to another place. it's the entity that's in control of the property involved. So if we have a publicly owned space where the agency of responsibility or jurisdiction of that piece of property comes to us, that usually happens when there's a significant concern, and it's most often an environmental concern. And so there's an example that I can give you on a county-owned piece of property in Los Osos, where we had gotten an encampment that had about 15 or 20 people spread around 8 or 10 tents set up on a very specific parcel. That parcel is controlled by Public Works and is mitigation land for the Los Osos water treatment and reclamation facility. So there are some state and federal requirements that the county maintain that piece of property as habitat for sensitive species and plants and et cetera. And it wasn't possible for the county to meet its obligations to its permits with camping occurring on that piece of property. And so that was a specific encampment that we went through a lengthy process, a month and a half long, with very intense outreach and trying to connect people to not only the, as Tim says, the temporary emergency type services, but also some more pathways towards permanent housing and then services such as mental health and drug and alcohol counseling, that sort of thing. But at the end of that period of time, we did end up clearing that public space because of an overriding environmental concern. And as Christina and Tim will probably be able to support, a lot of our encampments do tend to be in environmentally sensitive areas like creek beds and other areas like that. One of the reasons for that is a lot of that particular kind of property is publicly owned. Creek beds and other lands that are around environmentally sensitive areas. Disruption or dismantling of a encampment is really a very sensitive issue. It's very, it requires a lot of actual policy makers to be involved in the conversation of how to do that appropriately, while making sure that those displaced are given as much support and opportunity to change their circumstance as possible.
All right, thank you. And we're getting short on time here, but I would like to give Tim and Christina, if they would like a chance to respond to that issue, but we're going to have to get into questions pretty soon here. So Tim, do you want to add anything to what Stuart has said?
Absolutely. I totally agree. I mean, we're all environmentalists. We know how horrible it is for homeless people to live in the creek beds and under the overpasses. We know what goes on there. We've seen the trash, the urine, the feces, the hypodermic needles, all those things. Frankly, I don't understand how the public officials can. I've personally brought almost every city council person in San Luis and board of supervisors to the creeks, pointed out, this is public property. This is very bad. They should not be here. they are already on public property. Surely we can provide them with some other public property that is not in the creek watershed and really do the same thing, or perhaps at the same time provide a few of those services I mentioned before, like trash pickup, showers, toilets, and lockable, security lockers for their stuff so it doesn't get stolen. But the idea is, I don't understand why, if they're already on public property, we can't put them on non-sensitive, ecologically non-sensitive public property instead. I'm mystified. I mean, I talked to all the watershed employees for the city and the county, and they're horrified too. So yeah, we do have to make some moves like that. It's a twofer, environmentally and for the homeless as well.
Okay, Christina, did you want to comment?
Yeah, I agree with Tim as well. I think that we as a society, our community are going to need to figure out alternatives, for these encampments. And like Tim said, providing a designated space that does have the showers and the bathrooms and trash facilities, because that's true. You go to the encampments and there's so much trash. So it definitely is an environmental issue as well. So, but yeah, I agree with both of them.
All right, great. Well, let's get into audience questions here. I've got several in front of me here. I'm just going to start with, I think this is the first one that came in. What is the biggest barrier keeping people from permanent housing? Who would like to take that one?
Okay, happy to. First and foremost, people don't realize that the Great Recession followed the pandemic has made it worse for low income people. So I always look at as the unhoused and the low income butt up against each other. And what has happened is we've created less of a middle class here. So the lower end of our economy struggles even more than it has before, really prior to the Great Recession. So we really have to create unsubsidized housing for low income people that's affordable without the subsidies, because there's not enough subsidy money on the planet to create enough housing for the low income, and that intersection of the low income and the unhoused people to live somewhere that they can afford. And again, so it has to be simple, like tiny homes, small units, no parking spaces near jobs, things like that. We have to have different types of solutions for both the low income and the unhoused together, because they're, like I said, they're on different floors of the same boat.
Okay, here's one for, I'm not sure who. Why was the trash program, the blue bag program, abandoned? Does anybody know?
Well, I was extensively involved with it, and Ann Gillespie, who's the watershed coordinator for the county, did an amazing job, and I always have to give her kudos for that. The program was a success. It ran 4 weeks. We have amazing numbers. You can find the report online. Google Blue Bag Trash Pilot Program. You can read about it. Everybody involved said they wanted to continue it, and then bureaucratic lack of, momentum caused no follow-ons to happen. And frankly, I'm still hopeful that we will have a follow-on someday.
Okay. All right, anybody else?
Yeah, if I could add just it is my understanding that the Blue Bag project has not gone away. It is back in the attention of policymakers, and it is something that we very well might see in the not too distant future.
Yeah, and I also know that the Homeless Services Oversight Council has a encampment subcommittee that has been studying the issue now for just over a year, and they are just completing their final report, which should have some very good recommendations. And I think I've seen a draft of it, and it does include the Blue Bag program and some of the suggestions that you have been making about making the encampment areas safer and more environmentally sound. So we'll be anxious to hear about that. And one of our panels coming up will be about solutions. So we'll make sure we include those. I think this is a question for Stuart. Does Boise case law accept enforcement of trespassing?
No, Boise has to do with publicly owned lands, not privately held land.
Okay, all right, great. How about, has there been any effort to vaccinate the unsheltered against COVID? Does anybody know that?
Christina.
So I can speak on that, yes. So public health is starting to look at vaccinating the unsheltered. And I know that they've started at the homeless shelters and then are looking to go into the encampment. I think the biggest thing that they're trying to figure out from what I've been hearing is you have a 2 vaccine, vaccination. And so you get them the one, and then how do you find them again to get them the second one? And so can you just do the 1 shot Johnson & Johnson? Would that be better? Or is at least getting one of the 2 doses good, like good as well. So I know that is what they've been talking about. In Santa Maria, Dignity Health has a street medicine team that goes out twice a month into the encampments, and it has doctors and nurses. And so I know they're in talks with them as well about possibly going out and providing those vaccines, but I haven't heard any updates on that.
Okay, thank you. And here's one. Has the increase in homelessness coincided with the increase in high-powered marijuana?
I will take that.
Okay.
Certainly high-powered marijuana, along with the massive availability of what we're seeing as the China-made fentanyl and other opioids. And it's in that combination, as well as we know that they are consumed in conjunction with alcohol, which is a toxic cocktail, which is why in the last year, we've had so many homeless deaths. We actually had a ceremony at Mitchell Park for all the homeless people that we knew that had died in the last year. And it was like 22 people, and I knew most of them. So yeah, obviously, again, we always say, did drug addiction cause homelessness, or did homelessness cause drug addiction? And that's a really important question. Frankly, I often said, like 20 years ago, now it's got so much worse, but early on, I would say, if I was homeless, I'd probably become an alcoholic. I said that, but now with the low cost toxic drugs that are out there, I might become a drug addict instead of an alcoholic because it's cheaper and has a bigger buzz. But how, in the depths of depression, we do things we wouldn't otherwise do if we were housed and had hope. When you give up hope, you do a lot of things to feel good for a little bit. And those drugs like high-powered weed and opioids really make you forget how sad and depressed and screwed your life is. And you feel good about yourself for a while. So yes, it's gotten worse, and we've had the overdoses largely because of the undosed Chinese fentanyl and other opioids. So yeah, it's a growing problem. It's horrible.
Well, I would like to thank all of the panelists for really a very good discussion. We're sorry about the problems that we had with Tim initially, but we're glad we got you in. Your perspective is very, very valuable. And so thank you all very much. And I'm going to turn it over to Ann Havlick, who is the co-chair of the League of Women Voters of San Luis Obispo County.
Yes, I just want to agree with Marlis. This has just been a very interesting session for us today. And I want to do a special thank you to our panelists for joining us, and to Marlis for her wonderful work in organizing it and getting your questions together and looking at the topics. Reminder that this is the third in our 5-part series on the different aspects of homelessness. And it has been so enlightening because for most of us that aren't involved, we just see these homeless around the streets or these encampments and come up with simplistic thoughts about it, you know, or generalizations. And homelessness is a very complex issue. And there are so many facets, and it's not just, as we learned the first time around, one type of person. Very complex. I just want to say thank you so much. I also want to thank our communications committee under Jordan Bucara, especially Glenn Silloway, Dave Humphreys, and Janice Langley. This session has been recorded. If you were to go to our website, you can click on our link that says archives. You can see the recording of this when it's put up there, which will be shortly, and also the previous two. And those are available. They're also available on our YouTube site and on our Facebook. So please watch for future announcements about upcoming Lunch with the Lake. We've had other issues that we've talked about, but this has just been so important. We also want to tell you, for those of you who are not members, we have a little thing going on now, promotion, that from now until July 1st, you can join us for a vastly reduced rate and try us out. You know, it's like $25. So anyway, we're just so grateful to you for joining us, and been very, very informative and enlightening. If you can stay on after this program is over, because we will have a link to a short questionnaire, and we so much want to hear from you. It helps us so much. Thank you.
Okay.
So I think there'll be a couple of slides. There'll be one with your contact, our panelists' contact information.